Hello, and welcome to our group's project presentation on clinical presentations of malaria, created by Amanda Bowman, Alexandra Setzer, and Samuel West, under the supervision of Dr. Adrian Zepfi in the Department of Medical Laboratory Science. Our project evaluates the case of a patient at the University of Cincinnati Medical Center, UCMC, who experienced delayed diagnosis of proper illness. This illness being malaria. Malaria has unique laboratory characteristics that are often masked by flu-like symptoms in patients. Diagnostic characteristics can include observation of Plasmodium species in the peripheral blood, a high parasitic load, and corresponding conditions such as certain anemias. By understanding the clinical presentation of malaria, proper diagnostic techniques, and expected results, hospital staff will be better equipped to diagnose faster, avoiding delayed treatment for affected patients. So you may be wondering, what exactly is malaria? Where can you find the highest number of cases? And why do we care about malaria within the United States? Well, malaria is transmitted through mosquitoes infected with the Plasmodium species parasite. And when an infected mosquito bites a human, this Plasmodium species parasite can enter into human red blood cells, being carried throughout the body through the circulatory system. Being inside red blood cells allows the parasite to visibly grow and develop at a microscopic level, while also creating symptoms seen in the patient, characteristic for malaria. This illness is commonly seen in countries within the continent of Asia and Africa due to the tropical and subtropical climate present that allow for mosquito vectors to flourish. So while this climate barrier prevents larger numbers of malaria cases within the United States, we can still see cases due to international travel and issues with screening blood donations. The cases of malaria patients that do appear in the U.S. are likely to experience delayed diagnosis and inadequate treatment due to the fact that American lab and hospital staff are usually less familiar and inexperienced in diagnosing this condition. Did you know that 6 out of 7 reported fatal cases of malaria from the United States in 2017 were found to have delayed diagnosis and treatment times? That's because of lower treatment efficiency when anti-malarial medications are provided later to the patient. One example of delayed diagnosis and treatment was seen here in Cincinnati at UCMC in a 65-year-old male patient who presented with a persistent fever and body pain. These symptoms are vague and could indicate many conditions, so standard screening tests, including a complete blood count, CBC, cell differential, urinalysis, and chemistry panel tests were run on the patient. The results showed normal chemistry panels and urinalysis screen, with the CBC and cell differential indicating a diagnosis of aplastic anemia. The aplastic anemia diagnosis is helpful in this case, but did not aid the physician in understanding the root cause of patient symptoms. Because of this, a CBC, cell differential, and kidney analyte panels were ordered daily in attempts to diagnose the patient. Finally, on the 4th day of performing cell differentials, a lab technician identified the Plasmodium species at the trophozoite ring stage of development within the patient's red blood cells. Examples of these ring stages are identified by the arrows present. The identification of the Plasmodium species through the manual cell differential, along with the patient's previous diagnosis of aplastic anemia, allowed the physician to diagnose the patient with malaria. With the malaria diagnosis, a peripheral blood parasite test, also known as an MA-LSM, was performed and confirmed the presence of the parasite. Anti-malarial treatment was begun immediately, and another MA-LSM was performed daily to monitor treatment efficacy. On the 6th day of treatment, the MA-LSM confirmed the absence of the parasite. Fortunately, the parasite was discovered and treated properly in time to cure this patient. However, it is important to recognize the flaws in diagnostic laboratory and medical practice from this case. This patient was present in the hospital for a total of 8 days, with their condition not being diagnosed until the 4th day, and treatment not clearing the parasite until 4 days after that. While 8 days may not sound like much time to spend in the hospital, it's crucial to remember that from the 6 out of 7 reported malaria deaths within the United States in 2017, they were diagnosed 6 days after the onset of symptoms, which is only 2 days later than the patient in this case. By increasing training for laboratory and hospital staff to understand clinical presentations of non-endemic illnesses such as malaria, we can improve medical diagnostics and increase patient safety. Thank you so much for watching our presentation on clinical presentation of malaria. We hope that we are able to show you the importance of clinical diagnosis and patient treatment for this illness in non-endemic countries such as the US.